So the Affordable Care Act has changed the way a lot of people look at health care, specifically the health insurance.
Right. Frankly, there are a lot of options available, but there is nothing quite like the membership organization known as Mippa, which was created by physicians.
Yes, it was. With us this morning, Dr. Robert Falk and Ann Jones. Thanks for stopping by this morning.
Good morning. Thanks
Thank
for
you
having us.
We got a few things to cover here, but
Yep.
I want to start with the basics. The Midwest Independent Physicians Practice Association. What is it? And I guess give us a little background. What's the history here?
Yeah, it's been in existence for a little over 5 years, and yes, it is a group of independent private practice physicians, and again, it began about 5 years ago. The impetus was because there has been increasing consolidation within the healthcare market. There are fewer and fewer players within the healthcare market. If you look back just at Omaha, our little world here in the Midwest, you know, there used to be 8 or 10 different organizations that delivered healthcare, and now it got down to essentially 3. So part of the impetus here was to create an organization to provide more competition within the Omaha market, and also probably a key feature is to be driven and led by physicians and not by business people.
Well, I mean, we're regular patients.
Administrators.
You know, that's what appeals to you because you trust your doctor.
Well, I think part of that is probably one of our key differences is that we are physician-led and physician-directed. And I think if you intuitively think about it, you know, the biggest advocate for patients are usually the healthcare providers themselves. It's the doctors and the nurses. So when insurance denies something, who is on the phone to see if they can get that delivered for you? It's the physician or it's the nurse or someone else.
Connected.
So we are probably the most closely connected with the patient because we live with them on a day-to-day basis, and we live with them and help them through their illnesses.
Yeah, and more of an advocate as well.
Correct.
So through all this, through Mippa, there's a healthcare plan. Right.
That is correct.
Yeah.
How does it work?
Well, it's a healthcare plan which is available on the healthcare exchange. It was started again last fall, like most of them were, and it is a collaboration between Mippa and Coventry. And so the key feature really here again is that this plan was developed by physicians in collaboration with Coventry, and so the product is designed to give people a plan that we think has advantages because of the physician input.
How many physicians between Nebraska and Iowa?
There would be over 500.
Yeah.
Yeah.
A lot.
So as far as I'm aware, it's probably the widest network available.
And would you explain the exchange for our viewers who maybe they've heard the word, they've started to look around, they're still a little bit leery about this entire idea and the ACA. What do we need to know about the exchange itself?
Well, I think the health insurance exchange obviously is a provision that was laid out under the Affordable Care Act or the ACA. And what it does is that it allows people that have not had access to insurance plans before. Mostly we're talking about individuals, and so this is an option up until March 31st that people can sign up for and to get insurance so that they will be covered.
What happens after the 31st? Is this still available to people who didn't sign up prior?
My understanding is that it's not available again until fall.
Got it. When
registration
enrollment. Got
Exactly.
it.
Again, yeah. So the Mippa health plan is different from some of these other plans that we've been hearing about. So how is it different on the exchange?
And why is it better? Why do you think it's better? I mean, you might be a little bit biased.
Yeah, well, I'm sure we are biased, but I think again, I mean, the issue really is what do you have to back up your talk with? And I think that you know, I equate it to what I look for whenever I'm purchasing something, which is value. To me, value is a combination of price and it's a combination of quality, and it's where those two overlap the most that, in my opinion, you get the best value. So. In the case of the Mippa insurance plan through Coventry, I think that the price is very competitive. We're one of the lower priced ones, which I think is important. So price and the goal to make it accessible. Number two is, I think, what I consider the quality. And this is where I think you actually can't find these things on healthinsurance.gov. So there are things, for instance, like that people need to think about that are the intangibles. So this is driven by physicians, okay? So our goal is to make the widest variety of specialists and primary care physicians available to the public. We are not striving for a narrow network. We are trying to offer the most choice to patients that can possibly be obtained, which is maybe in somewhat of a contradistinction to some of the other plans. So I think we have the widest choice. Our goal is not to penalize patients for going outside of the network. We're not trying to say, look, get in our network, and then once we got you there, we got you. Our goal is to give you choice, which again goes back to our private practice concept of what many of us have seen is that one of our advantages of this network for the patients is that as private practice, non-employed physicians, self-employed, we have total autonomy to send a patient where we want to.
Yeah.
So if I have a patient and I think that patient needs to go to specialist A because of that person's experience, training, expertise for that particular problem, that's where I will send the patient. I have complete autonomy to do that by myself. Now, if I'm in a network of some other sort, I don't have that free autonomy. I don't have quite that same free autonomy. I have to get approval from somebody else to get it done.
And that makes, as a patient, it makes all the difference in the world and the confidence you have in that care.
It does. Your timing's good because you have about another month. People have another month and a half, a little over a month to get signed up for the Mippa health plan. So what's the first step? Where do they go? Just call the phone number on the screen, the 1-800 number in Nebraska, and then in Iowa, call the 1-800 number there.
Either call the 1-800 number, or you can sign up going straight to the web page that's listed there. I think sometimes maybe making the phone call will help through the many steps.
If you have questions, if you have questions.
Absolutely.
So there's a separate website for Nebraska, a separate website for Iowa as well. It's just CHC Nebraska and CHCiowa.com.
Thank you for being here. It's nice to see you.
Thank you for having us.
It's great to have you too.
Thanks a lot. We
Thank you.
appreciate it.
So